This lecture begins a series of lectures on paraphilic disorders. We will cover paraphilic disorders in detail to include fetishes, transvestic disorder, exhibitionism, voyeuristic, futuristic, pedophilic, S&M, which is sexual masochism and sexual sadism. We'll also cover the topic of sexting. Is it healthy or pathological? And we will dive into sex therapy. Paraphilias are patterns in which people repeatedly have intense sexual urges or fantasies or display sexual behaviors that involve objects or situations outside the usual sexual norms. The sexual focus may, for example, involve non-human objects or the experience of suffering or humiliation. Many people with a paraphilia can become aroused only when a paraphilic stimulus is present, fantasized about, or acted out. Others need the stimulus during times of stress or under other special circumstances. Some people have more than one type of paraphilia. The large consumer market in paraphilic pornography and growing trends such as sexting and cybersex lead clinicians to suspect that paraphilias may be far more common than previously thought. Now, according to the DSM-5, a diagnosis of paraphilic disorder should be applied when paraphilias cause a person significant distress or impairment, or when the satisfaction of the paraphilias places the person or other people at risk or harm, either currently or in the past. People who initiate sexual contact with children, for example, warrant a diagnosis of paraphilic disorder, regardless of how troubled the individuals may or may not be over their behavior. People whose paraphilic disorder involves children or non-consenting adults often come to the attention of clinicians as a result of legal issues generated by the inappropriate actions. Now, although theorists have proposed various explanations for paraphilic disorders, there is little formal evidence to support such explanations. Moreover, none of the many treatments applied to these disorders have received much research or proved clearly effective. Psychological and sociocultural treatments have been available the longest, but today's professionals are also using biological interventions. Some practitioners administer drugs that lower the production of testosterone, the male sex hormone, and replace the sex drive. Although these drugs may indeed reduce paraphilic patterns, several of them disrupt normal sexual feeling and behaviors. So, the drugs tend to be used primarily when the paraphilic disorders are of particular danger, either to the individuals themselves or to other people. Clinicians are also increasingly prescribing SSRIs, the serotonin-enhancing antidepressant medications, to treat people with paraphilic disorders, hoping that the SSRIs will reduce these compulsion-like sexual behaviors, just as they help reduce other kinds of compulsions. In addition, of course, a common effect of the SSRIs is to lower sexual arousal. Now, a word of caution is in order before examining the various paraphilic disorders. The definition of these disorders, like those of sexual dysfunction, are strongly influenced by the norms of the particular society in which they occur. Remember, experts recognize two general categories of sexual disorders. We have the sexual dysfunctions and paraphilic disorders. People with sexual dysfunctions have problems with their sexual responses. A sexual dysfunction is a disorder marked by a persistent inability to function normally in some area of the sexual response cycle. Some sexual disorders include the male hypersexual desire disorder or the female sexual interest or arousal disorder. Now, people with paraphilic disorders have repeated and intense sexual urges or fantasies in response to objects or situations that society deems inappropriate, and they may behave inappropriately as well. They may be aroused by the thought of sexual activity with a child, for example, or of exposing their genitals to strangers, and they may act on those urges. Some clinicians argue that except when other people are hurt by them, at least some paraphilic behaviors should not be considered disorders at all, especially in light of the stigma associated with sexual disorders and the self-revulsion that many people feel when they believe they have such a disorder. We need to be very careful about applying these labels to others or to ourselves. Keep in mind that for years, clinicians considered homosexuality a paraphilic disorder, and their judgment was used to justify laws and even police actions against gay people. Only in 1987, when the gay rights movement helped change society's understanding of and attitude towards homosexuality, when clinicians officially stopped considering it a disorder and removed it entirely from the DSM. In the meanwhile, the clinical field had unintentionally contributed to the persecution, anxiety, and humiliation of millions of people because of their personal sexual behavior that differed from the conventional norms. In these series of episodes regarding paraphilic disorders, we will review, according to the DSM-5, fetishes, transvestic disorder, exhibitionism, voyeuristic disorder, pedophilia, S&M, which is sexual masochism and sexual sadism. We will also review the topic of texting. Is it healthy or is it pathological? And we will dive deeply into the different types of sex therapy.